Hi, hello, welcome to my channel Med Wizards.
In today's video, we will be learning about pressure ulcers, which is also known as decubitus ulcer.
So, what do you mean by pressure ulcer or decubitus ulcer? So, an ulcer, when it forms on an area of the skin with prolonged pressure due to immobility, it is termed as pressure ulcer. It can also form in the areas that remain wet due to constant contact with the body fluids like urine or sweat. So, this happens mostly in patients who are bedridden for longer duration. Also, it is a sign showing that neglected nursing care. This is why we advise nurses to maintain frequent change of position in patients so that we can prevent pressure ulcers. Wet sores most often develops on the skin that covers bony areas of the body such as the heels, ankles, hips as well as the tailbone, which directly is in contact with the hard surface. Pressure ulcers are commonly seen among older people who spend long periods in bed or wheelchair, who also have delicate skin or who are have decreased mobility, who are not mobile for longer duration. This condition actually is a treatable condition, but chronic pressure ulcers can be challenging to treat. The specific outlook depends on several factors, including underlying medical conditions as well as the stage of ulcer at which we have diagnosed it. This is a preventable, completely preventable condition. Especially stage 1 and stage 2 ulcers are completely preventable condition and it is completely curable condition compared to stage 3 and stage 4 ulcers. So how this pressure ulcers happen in people? When a person is lying continuously on bed for longer duration, that continued pressure will reduce the blood flow as well as other fluids to that tissue which is directly in contact with the bed. This causes damage that leads to the cell death, skin breakdown, and eventually it will form an open wound. That is how pressure ulcer will be formed. In this picture again you could see how pressure points of a person in their body when it is rubbed against the hard surface, when there is no friction, when there is no movement, how pinching of blood vessels is happening out and how it is impacting the bone. So this is how pressure ulcers will be formed when there is no movement in a person. Moving on to the stages of pressure ulcers. The stages of pressure ulcers are classified on how deep the pressure ulcers are formed in a person. The staging also describes symptoms, the extent of tissue loss happened, and the anatomical features of each pressure ulcer stage. So there are different classification systems, but commonly we use the National Pressure Ulcer Advisory Panel, which included the most recent research and clinical expertise regarding these conditions in its 2016 revision of its staging system to include following criteria. Here you could see the differences between each stage. In the stage 1, only the superficial layer of the skin, that is the epidermis, will be affected. Stage 2, it will be going to the second layer of the skin, that is to the dermal layer. Stage 3 to the hypodermis. Stage 4 including the muscle, and even it may expose the bony surface sometimes. So initially it was only 4 stages, but now they have added even 2 more stages to this. So the first stage, this is the earliest stage of pressure ulcer. That is, as I have shown you in the previous picture, only the epidermal layer, that is the superficial skin, only will be affected. So intact skin you can see, but there will be persistent erythema. Erythema is nothing but the redness of localized area, and usually this will be appearing on any bony prominences. So any bony prominences like elbow, so such areas you can see this type of stage 1 ulcer. And usually this erythema is non-blanchable. Non-blanchable means when you touch the skin, when you touch with the pressure on the skin, if that lightening of skin is happening with the pressure, means we call it as blanching. So if it is not happening, we call it as non-blanchable erythema. Some observable differences in the affected area in stage 1 include any one of the following characteristics, like changes in the temperature to either cool temperature or warm temperature. There may be changes in the skin texture. Induration, that is how hardened the tissue forms. Edema, any swelling is happening in that area. Burning sensation like inflammation. Pain, itchiness. And people who are having dark skin, their skin color may be turns into blue or purple color. So any of one of these following characteristics may be observable in stage 1 type of pressure ulcer. A stage 1 pressure ulcer may get cured within 2 or 3 days, as only the superficial skin will be the affected part. If at all a person is sitting for a long period or sleeping a lot, then they have to move at least once every 2 hours. That will help in preventing the occurrence of stage 1 pressure ulcer. In the next stage, that is stage 2 pressure ulcers, these are diagnosed when the intact skin suddenly breaks open. So it looks like a pus-filled blister, and from that blister you could see clear fluid or pus oozing out, which will be more painful. So that is stage 2 type of pressure ulcer. The features what you see is like a partial thickness skin loss, which involves the epidermis as well as the dermis, and there will be a possible breakage at the top layer of the skin. Because of the breakage, you could see the inner layer. So it looks like a shallow cut or a blister or an abrasion formed on the skin surface. There will be discoloration of the skin around that sore area and pain at the site of sore. The wound usually may be looking pink, red as well as moist. When you touch, it will be warm to touch. There will be clear fluid from that skin, oozing out from that skin. But here in stage 2, there won't be any eschar formation, which looks like a dead, dry, leathery tissue. That won't be seen, as well as there won't be any granulated tissue. And sloughing of the tissue also will not be happening. Sloughing is like removal of that layer of the skin, so that also will not be seen in stage 2. Apart from this, whatever above mentioned will be seen here in stage 2 type of pressure ulcer. The stage 2 pressure ulcer should be cleaned with water or a salt water solution, and then it should be dried off. This also can be cured. It can get better within 3 days to 3 weeks based on the nursing care given to the patient. So both the stage 1 as well as stage 2 are completely curable types of pressure ulcers. The next stage, that is stage 3. In this, the pressure ulcer is much more deeper within the skin. It affects the fat layer and looks like a crater. This stage may also show the signs of infection like red edges, pus, odor, heat as well as drainage. In stage 3 pressure ulcer, you could see full thickness loss of skin, which may extend to the hypodermis or even to the subcutaneous layer, that is the innermost layer of the skin. Sore with a crater-like appearance. Crater is a deeper pit-like appearance you can see, as well as increased damage below the surface of the epidermis, which makes the wound deeper. But here, in this stage 3, there won't be exposure of bone or tendon or muscle. That will not get exposed, which is possibly exposed in the stage 4. As well as it may also show potential signs of infections like foul odor, pus, redness, discolored drainage, and any one of the characteristics of granulated tissue or rolled edges of the wound, sloughing or scar formation. Any one or more than one characteristic can be seen here in stage 3. So a little more deeper compared to the stage 2, a little more deeper the wound can be seen. Stage 3 pressure ulcers require more time. It will take approximately at least 1 month, and it may proceed up to 4 months to heal with utmost care. The next stage, that is stage 4. In this stage, all the skin layers, including the muscle and bone, are affected, and this is a little most serious condition. Here, the skin may turn black. It shows the signs of infection like red edges, pus, odor, heat, as well as drainage. In this stage 4, the characteristics are full thickness tissue loss, because including the bony layer it is involved. The wound will expose the bone, tendon, ligament, fascia or cartilage or muscle, and the skin will be severely damaged as well as the tissue will be severely damaged. The wound size of the wound will be a little larger wound, and there will be potential infection. Chances of infection is more in such wounds. Along with that, there are potential chances of occurrence of either one or more than these characteristics mentioned below, like rolled edges of the wound, sloughing, scar formation, undermining or tunneling of that wound deeper, a little deeper. So these are the characteristics which we observe in stage 4 pressure ulcer. The time taken for a stage 4 wound to heal is approximately from 3 months or even much longer. Some people may have their wounds carried on for many years also, so it may take many years to heal. The added stage is unstageable pressure injury. Here you could see full thickness injury both from the stages 3 as well as stages 4 injury, deeper injury, which cannot be staged under any of that stages mentioned above earlier. Entire wound base is obscured by the sloughing or an scar formation, like a burnt tissue, how it is like that. We would be seeing that injury, pressure injury. So that is why it is termed as unstageable pressure injury. We cannot stage it. The last stage of pressure ulcer is the deep tissue pressure injury, which can be seen in the localized area with an intact skin. A skin may be present or without the superficial layer of the skin you could see, and persistently non-blanching deep red, maroon or purple discoloration can be seen along with that. Or there will be separation of epidermal layer. When you could see that epidermal separation happening, it reveals a dark wound internally or a blister which is filled with blood. Skin color changes preceded with pain and temperature changes. Possible evolution to reveal the extent of tissue injury which should be done here. Prevention of pressure ulcer. Moving an immobile person for every 2 hours is one of the best available option to prevent the occurrence of pressure ulcers, as well as providing with comfortable devices, especially like pillows or sandbags. Using such comfortable devices also under the pressure areas will also reduce the occurrence of pressure ulcers. Monitoring a bedridden patient by paying special attention to the common sites of pressure ulcers at least once in the morning and once in the evening can also help you to identify early signs of pressure ulcers. We must keep their skin clean and dry after sweating as well as after bowel or bladder movement. Complete drying out of their skin with hard soaps or lotions that containing alcohol should be avoided because dryness of skin also will cause breakage of the skin. And do not use hot water which can dry out or burn the skin when assisting in their bathing. So these measures also will help in preventing pressure ulcers. We must make sure that hard pressurized rubbing or massaging of skin must be avoided in such patients, and we need to check their equipments also regularly, which may wear off and which may cause harm to the skin of the person, as well as providing them with a well balanced diet which contains plenty of fluids also keep their skin hydrated and moist. What is the treatment done for a pressure ulcer? Treatment depends on the extent of the injury when it is diagnosed. First, in the treatment, we will be discussing about conservative treatment. In this conservative treatment, we won't be using any invasive measures or any other invasive surgical procedures and all. So this conservative treatment is adequate for the stages of 1 and 2 type of pressure ulcers. Conservative treatment includes removing the source of pressure from the affected area and keeping the wound clean by using a mild soap and water. We can rinse it, or by using a normal saline solution also we can clean the wound. We must make sure that we have to avoid hydrogen peroxide or iodine cleansers which causes damage to the skin surface area as well as it irritates the skin. And also we need to cover the pressure ulcer with medicated gauze or other special dressings. So this is the conservative treatment usually adequate for stages 1 and stages 2. We need to make sure that the affected area must not be dry. Maintain proper moisture balance by keeping the affected area moist with a water resistant agent like Vaseline so that healing can be possible. Ensure that good nutrition is supplied to the patient as well as effective hydration is done. Divert any urinary as well as fecal materials away from the pressure ulcer depending on its location. Powder sheets lightly to avoid rubbing on the surface. Wrinkling of skin, wrinkling of bed sheets also should be avoided. After conservative treatment, we have the next modality, a surgical treatment, which may be necessary for stages 3 as well as stages 4 of pressure ulcers. So here in stage 3 and stage 4, conservative treatment may not be adequate enough. The first management comes as debridement, where we will be removing the damaged or infected or dead skin tissue, which will be followed by flap reconstruction. Skin grafts is another surgical method where we will be transplanting a healthy skin surface to the wounded area. Negative pressure wound therapy is one more surgical management, which is a sealed wound dressing attached to a vacuum pump that sucks the fluid away from the wound. Treatment of an infected pressure ulcer typically involves the use of antibiotics or antiseptics to kill or slow the growth of the source of infection and also helps in preventing the infection from worsening or spreading. How can you recognize that a pressure ulcer is healing? So here we will see the signs of pressure ulcer healing. The signs include when the size of the pressure ulcer increases, the formation of pinkish tissue along the edges moving towards the center of the pressure ulcer is seen, smooth or bumpy surfaces of new tissue is seen, or some bleeding, which is considered as a positive sign because that shows there is good blood circulation that promotes healing at the affected site. So these are few signs that shows that a pressure ulcer is healing. Preventing the onset of pressure ulcers is the best way to avoid the severe problems that can result. Frequent movement or change of positioning, proper bedding, providing with cushions, and sound skin hygiene can reduce the risk of having pressure ulcers.